Welcome to Family Basics 101. I'm Dr. Bruce McClure, and as we conclude a 5-part series entitled Phobias, today we will talk about how do you treat phobias. The goal for treating any phobia, according to the Mayo Clinic, is to assist the patient in decreasing their anxiety. That is the number one purpose in treating a phobia. Beta blockers are used to reduce the stimulating impact of the adrenaline that is produced. Therefore, it's going to slow down a racing heartbeat. It's going to bring back into a more perfect balance an elevated blood pressure, and it's going to help alleviate a shaken voice and nervous body movements. People who experience fear of public speaking, for instance, better known as stage fright, often benefit from the beta blockers. A second remedy for dealing with phobias are antidepressants. Antidepressants are used mostly to regulate the flow of the serotonin, which is really a neurotransmitter in the brain. Medications that are antidepressants typically are things like Prozac, Paxil, Zoloft, and Celexa. A third way of treating phobias is through sedatives. Sedatives are used to help a person simply to relax. Sedatives are drugs such as Ativan, Valium, or Xanax. Each of these drugs must be managed closely by a medical doctor, a psychiatrist, a general practitioner, but a medical doctor because of their highly addictive nature. Whether you're using the beta blockers or whether you're using antidepressants, all of the medications must be utilized, if at all, under the oversight of a physician. Be very careful about trying to order these type medications online and taking care of the management of it yourself. When you talk about treatment of phobias, there's also a method of behavioral therapy. In the behavioral therapy, we're looking more at desensitizing the person from the phobia. We're looking at moving the person into a more calm, more relaxed way of viewing the phobia or the fear that they are dealing with. It's also called exposure therapy. So whether you're talking about behavioral therapy, desensitization therapy, or exposure therapy, what you're doing is getting the person to a point to where they can be in the same environment, whether it's a visual environment, whether it's a talk environment, whether it's a touch environment, an over time lapse environment with the very thing that is creating the high escalation of anxiety. Each method of exposure therapy, each step of the exposure therapy, each step of desensitization therapy, or each step of behavioral therapy is really designed to move the individual into their phobia. You move the person step by step by step into their phobia, which ultimately will help extinguish or move the person more healthily out of their phobia. This may involve first spending time simply defining what is a phobia, giving the person a clear understanding of what is creating the anxiety, just talking about the phobia, talking about how they impact the quality of life, then identifying, if possible, what is the source of the phobia. And then maybe at some stage looking at photographs of the very thing that is creating the phobia. So you start out defining, let's talk about what is a phobia. Let's take a look at how are these phobias or this phobia impacting your quality of life. And then let's take a visual look, maybe with photographs, of the thing that you're saying, the objects, the people, the places that are creating this anxiety inside you. And then maybe at some point, visiting at a safe distance the site that is or is similar to the phobia that the individual is experiencing. And then maybe at the proper time, if that ever presents itself, engage in the phobia. Touching, let's say it's the fear of snakes. Picking up or being in close proximity, let's say if it's the fear of insects. Or going up in an elevator if there's a fear of height and a fear of being in a closed-in space. So at some point, maybe after dealing incrementally with defining, after talking about it, after viewing it through a photograph, after looking at the situation from a safe distance, and then maybe at the appropriate time, actually allowing the individual under supervision to actually engage the phobia, which over time will begin to cause the phobic response to disappear. Thus we have desensitized, thus we have exposed the individual to the phobia, and now they are understanding that their phobic reaction is not as big as the event that stimulated it. In the book of John, chapter 20, verses 26, 27, and 28, there's a text that deals with the post-resurrection of Jesus. Some events that takes place among his disciples after the resurrection. After 8 days again, Jesus appears with his disciples. Thomas, who is known as Doubting Thomas, is with the disciples. Then came Jesus. The doors were shut. So he walks through the doors without opening the doors. And he stood in the midst of those disciples, and he said, "Peace be unto you." Then said he to Thomas, "Reach in with your finger, and I want you to behold my hands, and then reach hither with your hand, and thrust it into my side, and be not faithless, but believing." Now I want you to see the progress in this. Jesus, after 8 days, appears to Thomas. And Thomas had doubts about the resurrection of the Savior. Jesus stood in the midst at a distance, and then he speaks. And then he speaks directly to Thomas. And then he says, "Thomas, I want you to take a finger first. And then I want you to take your hand and thrust it in." Do you see the progression of that? And ultimately, it brings Thomas to alleviated anxiety, the treatment of phobias. I'll see you back in class again next time. Don't be late, and don't skip class.